Time again for another segment of Ask the Expert with Tammy from Homeland at Home. Good afternoon, Tammy. Thank you for coming in. We received an email from Amy in Camp Hill. Is it true that only a doctor can talk to hospices about admission?
Oh, absolutely not. Most often, the initial conversation is between a family member and a hospice provider. We can answer any and all questions there may be. We can meet with the patient, the caregivers, the families at their convenience, and we can even assist in obtaining that required order from the patient's physician.
Are there any other misconceptions you'd like to mention?
Unfortunately, there are. Many people mistakenly think that it's just a program for the elderly, but we at Homeland Hospice have cared for infants, children, teenagers, and adults of all ages. People also think that a do not resuscitate order is a requirement, and that is not the case. A DNR is not required to be admitted to hospice services. In fact, we currently have a number of patients that are what's called a full code. Another misconception is that you cannot go to the hospital, and a patient always has the right to go to a hospital for treatment. But the goal in hospice is, however, to eliminate those trips and keep the patient comfortable at home. The most important thing, though, is that hospice is not about giving up hope. It is actually about making sure that whatever time is remaining for the patient, that they provide the best care and that they had the best quality of life.
Well, it sure sounds like hospice makes a hard reality much easier for everyone, doesn't it?
We try. Our goal is to not only provide the best possible care to the patient, but ongoing support to the families and caregivers throughout this difficult time.
Thank you so much for coming in today, Tammy. We appreciate it. Next week, we'll be discussing starting the hospice discussion. If you have any questions about hospice, home health, and home care, you can email the question to questions@homelandathome.org.